Good morning, everyone. Today we have the third lecture in pharmacology. Regarding pharmacokinetics, we have two kinds of kinetics. First order kinetics. In this case, drugs in the body are subjected to metabolism at a rate directly proportional to the concentration of drug. So by increasing the concentration of drug, metabolism will increase. هنقدر نقول انه اكو علاقة طردية بين rate of metabolism وال concentration مثل ما هسه راح نشوف بالفيجر. In the second type we have zero order reaction, or what's called as saturation kinetics. As the amount of drug in the body raises, metabolism becomes saturated. That means the rate of metabolism reaches maximum and no more increase in metabolism rate, even with increasing concentration of drug. This may be due to limited amount of enzymes. The enzymes are saturated by high free drug concentration and the rate of metabolism remains constant. يصير حالة إشباع، يعني الميتابوليزم هو يعني يعتمد على some mechanisms اللي قد تكون بها some enzymes involved. فهذه الانزيمز عندها طاقة محدودة، يعني ما تقدر تتعامل مع كميات لا محدودة من الدواء. فإذا زيدت الكونسنتريشن وصلت في ليفل معين راح يصير ساتوريشن إشباع، بعد تكون في أقصى طاقتها الانزيمز. ف any more increase beyond that اللي راح يصير إنه الميتابوليزم rate will not increase. هو هاي وصل يعني للحد الأعلى وثبت عند هذا المستوى. any addition of the drug, it means only increase in drug concentration, but there will be no increase in metabolic rate. As you can see in this figure, the effect of drug dose and on the rate of metabolism. أول ما تبدي تعطي الدواء يكون concentration مالته low. At low doses, drug metabolism is first order, that is proportional to the drug dose. يعني أكو علاقة طردية ما بين الدراج دوز والميتابوليك ريت. كل ما تزيد الدوز أو ويزيد الكونسنتريشن الميتابوليك ريت راح يزيد. لكن شوي شوي as we increase more and more we will get to a level يعني اللي هو at high dose اللي هو drug metabolism is zero order, that is constant and independent of drug dose. هنا نزيد احنا الدراج دوز لكنه الميتابوليزم ما يزيد وياه بنفس النسبة، فمعناها وصلنا للزيرو اوردر kinetics. And actually most of the drugs follow this pattern. يعني they start with they start with first order kinetics and then at high doses they get zero order kinetics. At low doses, drug metabolism is first order, that is proportional to drug dose. At higher doses, the first order is transformed into zero order, and the following changes will occur. Metabolic rate remains fixed. Second, the concentration of drug will increase. And third, the half-life will increase. We will see what is half-life in the next few slides. Now we come to a new topic, which is elimination. Drugs are eliminated from the body Otherwise, accumulation of the drug in the body may lead to toxic effects. What are the causes of accumulation in drug in the body؟ شلون يتجمع الدرug in the body in high concentration? Either by frequent dosing, more than supposed to be taken, or renal failure. As you know, the kidney is a major organ for elimination. So when there is renal failure, this will lead to reduced elimination of drug. Or hepatic failure. Again, the liver is another major organ of drug elimination. So in this case, the drug is not metabolized by the liver, and there will be no secretion of the drug in the bile. This figure shows drug elimination by the kidney. Free drug enters glomerular filtrate, and through Bowman's capsule it enters into renal tubules. In the proximal tubule we have active secretion, and then in the distal tubule we have passive reabsorption of lipid-soluble unionized drugs that has been concentrated in the intraluminal space, and its concentration is greater than that of the perivascular space. Only what is left that is going to be eliminated through urine is ionized lipid insoluble drug. What are the drugs of drug elimination? First, the kidney, which is a major organ for drug elimination. And as you know, what the mechanisms involved in this process. First, we have the glomerular filtration. هذا يعتمد on the concentration of free drug in plasma and the molecular weight, which means substances less than 1000 Dalton molecular weight. There were most drugs included in this level. Here pass easily through the pores of glomerular membrane. Second, we have the renal tubular excretion in the proximal tubules, which is an energy dependent mechanism, or what we call as active transport. Third, we have the renal tubular reabsorption in distal convoluted tubules, which depends on the pKa of the drugs and the pH of the filtered fluid, which is known as passive transfer. The second major organ for elimination is the liver, or what we call as hepatic elimination through the bile. It is mainly for lipid-soluble drugs. The fecal elimination happens when a drug is intended for systemic effects that is taken by mouth. Some of it will remain in the bowel and then excreted in feces. Another mechanism for fecal elimination is that drug diffuses from blood into intestinal lumen and is excreted in feces. And lastly, the biliary drug excretion that is excreted into feces. There are other organs for elimination. The lung, as we call it, the pulmonary elimination. This is important for gases and volatile liquids only. Inhalation of general anesthetic agents such as halothane is mainly eliminated through lungs. There are other routes which are of minor importance, like sweat glands, salivary glands. The amount of drug excreted in these routes is very small. The milk glands, elimination of drug through milk, will expose infant to drug effects and toxic effects. هذا الموضوع يعني له أهميته during يعني lactation when the mother nurses the baby or breastfeed the baby. Now we come to clearance. What is clearance? It is another name for elimination of drug from plasma that is quantified. يعني هو خلينا نقول مصطلح عملي ورقمي أكثر من elimination. Elimination we can say it is a theoretical concept. يعني calculations they usually use this term. They say clearance. They don't use elimination. And the kidney and liver are the main organs responsible for drug clearance. If we try to calculate the clearance for the whole body, we should scientifically or to be precise, we should add the hepatic clearance plus renal plus pulmonary and other organs, as we have mentioned before, the sweat glands or salivary glands, to get the clearance of the whole body, to get the total clearance. However, renal clearance is more powerful and easier to measure. Thus, when clearance is mentioned alone, it means renal clearance. احنا هسه قلنا هو يعني precisely and scientifically ترى هو الكليرنس يشمل many organs، لكنه لأن الرينال clearance is very easy to measure، يعني هو بمجرد انه تجمع اليورين وتحسب how much drug in it، فهذا يعني is very easy to calculate. ولأنه أيضا الكدني is a powerful, the most powerful organ for drug clearance، فقال لك احنا نعتبر الرينال كليرنس هو الكليرنس، يعني يمثل الجسم كله. يعني فأنت when you read clearance in a textbook it means renal clearance. So what is the definition of clearance now? It is the rate of elimination of drugs in urine relative to plasma concentration. لاحظ in urine. Clearance value can provide useful information about the biological fate of a drug. هاي المعادلة يعني مال الكليرنس، يعني الكليرنس هو يعادل الفلتريشن ريت plus secretion rate minus reabsorption rate. هاي الأشياء اللي هسه ذكرناها قبل شوية تذكرون بالفيجر مال drug elimination through the kidney، كان عندنا filtration، كان عندنا secretion، كان عندنا reabsorption. المحصلة مالتهن تقسيم البلازما concentration will give us the clearance rate. The renal clearance of a drug eliminated only by filtration by kidney obviously cannot exceed the glomerular filtration. إذا drug يطلع only by filtration فراح يكون الريت ماله for male 124 ml per minute while for female is 109 ml per minute. While if a drug has a renal clearance in excess of this، إذا كان أكثر من هذا الرقم، معناها شنو؟ that this means that kidney tubules must actively secrete it. There is active secretion. like benzylpenicillin اللي هو الرينال clearance ماله 480 ml per minute and vice versa، والعكس بالعكس. Now we come to a new topic which is drug dosing. When we have IV injection of a drug، يعني single dose injection, this will achieve the highest concentration in plasma. Then there will be a sharp drop in concentration from plasma due to drug distribution around the body, which is a distribution phase, and then the drug concentration declines later as the drug being removed from the body by kidney or liver, which is the elimination phase. While when we have oral dose of drug there will be gradual rise of plasma concentration reaching a peak distribution phase and followed by decline which is the elimination phase. هاي ليش ده يصير؟ لأنه أنت من تعطي الأول دوز يعني this will require some time to be absorbed from the intestine. فهو أول ما تعطيته هو طبعا تركيزه بالدم صفر، يحتاج لفد minutes or hours to be absorbed and this will take time. فشوي شوي راح يصعد البيك بالبلازما يوصل فد maximum limit وبعدين يبدي distribution وبعدين شوي شوي ينزل. while بال IV injection لا هو since you give the drug at the time of giving هو يكون أعلى concentration بعدين شوي شوي يبدي يقل. This figure shows what we have said about the previous slide. When you give a drug IV at the first second you have the highest concentration of drug in plasma and then it's followed by distribution phase which shows gradual decline and later on there will be elimination and you will go into the decline phase until the drug is totally eliminated. While in oral route the first instant or the second of giving drug there will be no drug at plasma and gradually the drug builds up in the plasma then reaches a peak followed by decline phase. This figure shows when you give a drug at several doses and this applies for orally given drugs. At the first dose نشوف هنا at the first second هنا concentration is 0, it gets higher, then it peaks, then goes down, then after the second dose it gets higher more and then it peaks and then goes down. Then after several doses, let's say after the 5th dose we will get a fixed concentration, let's say fixed average concentration. هو متغير لكن احنا بننظر للافريج فهو يظهر لنا مثل هذا الخط الازرق. الخط الازرق يمثل الافريج concentration واللي هو هنا نشوفه after the 5th dose يكون يعني flat يكون fixed concentration. ليش؟ انه وصلنا الى ما يسمى بالsteady state concentration. المطلوب في العلاج أن يكون ال steady state concentration within the therapeutic range، لا يكون يوصل للtoxic range ولا يكون within the subtherapeutic range. بالtoxic range يكون عندنا toxicity while in subtherapeutic range there will be no effectiveness of the drug. Steady state concentration is a state of equilibrium reached when drug doses are given repeatedly. And so after a period of time the amount of drug absorption equals drug elimination from body. At steady state the input, which is rate of administration, equals output rate of elimination. This means that the mean plasma concentration of drug remains constant. The aim of getting a steady state concentration is to keep plasma drug concentration within the therapeutic range. لاحظ هذا therapeutic range is very important. هو هذا المستوى اللي يكون به الدواء مفيد وآمن. effective and safe. effective لأنه لا يشتغل، safe لأنه ما بي toxic effect. إذا أنت أعطيت دواء in high doses ووصلت لل toxic level you are يعني making harm to patient, while if you give at low doses in the subtherapeutic range you are just wasting the time and effort and the money of the patient when the patient comes to your clinic and gets a drug that's not working. And so, for a drug to be safe and effective, we should keep the drug concentration at target site of action within therapeutic range for sufficient time. لاحظ هذه الكلمة sufficient time. This is variable. This time could be few days. مثلا واحد عنده tonsillitis يمكن تعطيه antibiotic for 5 days. Could be several months. مثلا واحد suffering from TB السل أو التدرن. You should give at least for 6 months. And sometimes this time is for life. يعني مثلا الأمراض المزمنة like hypertension or diabetes, they should get their treatment for life. So this is very variable. And maybe this sentence, هي ثلاث سطور, maybe the most important sentence in the whole lectures in this module. Above therapeutic range, as we said before, the drug would be a toxic range at high concentration, and thus the drug would show side effects and would be unsafe, while below therapeutic range, the subtherapeutic range, drug would be not effective, and thus it would be waste of time, effort and money. This figure shows that faster rate of infusion does not change the time needed to achieve steady state. Only the steady state concentration level changes. هنا احنا بهذا الكيرف الهاير كيرف هذا احنا اعطينا faster rate of infusion، بس هو يعني ما وصل للستدي ستيت اسرع. بس هاي يعني مجرد اوضح هاي الفكره، يعني هم بالنتيجه هم يوصلون للستدي ستيت at the same time، لكن مجرد ان الستدي ستيت concentration for this higher rate is higher than that of low rate. What are the methods of prolongation of drug action? There are several methods. First, using high dose. To this method, there will be increase in the steady state concentration level and prolongation of half-life, but there is an increase in toxic effect. This is not always acceptable, so other methods may be preferred, like using local vasoconstrictor agents، يعني مادة تؤدي إلى تضيق موضعي في الأوعية الدموية، will reduce local blood flow so that distribution of drug away from the injection site is retarded. مثال عليها local anesthetic xylocaine action is prolonged by combination with adrenaline. هو هذا يستعمل في طب الأسنان، عندما يحاولون أنهم مثلا يسوون فد قلع للسن أو فيعطون تخدير للثم، اللي هو يعطون مخدر الزيلوكين حتى يشتغل for a long time. It should be mixed with adrenaline. Adrenaline هو local vasoconstrictor، يؤدي إلى أنه الأوعية الدموية البلثة اللي في مكان الانجكشن will be blocked، and thus الزيلوكين ما راح ينتشر بالجسم. إذا تعطيه بدون أدرينالين راح ينتشر بالجسم وما راح يعني يكون تأثيره يعني قوي أو long lasting، راح يروح تأثيره بسرعة. بينما إذا you block the blood vessels at this injection site, this will keep the drug at the injection site for a longer time and make it longer acting. Third, by slowing metabolism of drug. Carbidopa is used in combination with levodopa for Parkinsonism. levodopa هو دراج يستعمل بالباركنسون ديزيز اللي هو يسموه شلل الرعاش، لكن مشكلته انه يعني when it enters the circulation there is an enzyme that degrades this drug quickly within seconds، يقضي عليها، فما راح يوصل للسي ان اس ولا راح يشتغل. زين شو نسوي؟ شافوا انه اكو طريقه انه we mix the levodopa with a similar drug اللي هو اسمه كاربيدوبا. هذا كاربيدوبا مجرد انه يعني it will be شلون كبش الفداء يمكن إذا صح التعبير، انه حتى الانزيم اللي يسوي كاتابوليزم او ميتابوليزم للليفودوبا it will leave levodopa and starts working on carbidopa, and thus levodopa will escape the metabolism and can reach the CNS. Another method is by delaying drug excretion. مثال عليه the use of probenecid to block renal excretion of penicillin when the latter is used in a single dose to treat gonorrhea. البنسلين هو drug of choice for treatment of gonorrhea اللي هو نوع من انواع sexually transmitted disease. لكن مشكلة البنسلين it is short half life، يختفي من circulation بسرعة، elimination ماله سريع. ف how to prolong the half life? By giving probenecid. Probenecid, it blocks the renal excretion of penicillin, and thus the penicillin can stay for a longer time in the plasma and can treat gonorrhea. The fifth method, by altering molecular structure. مجرد تغيير التركيبة الكيميائية للدواء. مثال عليها الهيبنوتيك ايجنتس اللي هي بنزودازيبينز. عندنا ديازيبام وعندنا other derivatives مشتقات من الديازيبام اللي هي بعضهم has longer half life، مجرد انه تغيير بسيط في التركيبة الكيميائية للدواء. 6. We have pharmaceutical formulation, as with sustained release oral preparations or depot injectable preparations. depot injectable preparation ذكرناها سابقا في المحاضرة الأولى. sustained release هذني نوع من oral formulations، نوع مثلا من التابلت اللي هو يعطي الدواء ماله بشكل بطيء for long time، يلا يعني يعطي الدواء ماله، فبهالطريقة يكون التأثير ماله طويل. قد يكون هذا السستين ريليس على شكل يعني مصنوع الدواء على شكل طبقات، فمن يعني يدخل الانتستين it will dissolve layer by layer, and in this case it will give a longer action. Now we have a new topic, which is the half-life. It is abbreviated as T small with half. It is the time needed for elimination of 50% of drug concentration in plasma. It is a constant for each drug. What are the factors affecting half-life? First, rate of excretion, which is inversely proportional with half-life. Rate of metabolism, which is inversely proportional with half-life. Storage of drugs in tissues, اللي هو higher volume of distribution. هذا هسه نجي له في المحاضرة القادمة شنو volume of distribution, which is directly proportional. And protein binding, واللي هو directly أيضا proportional. It leads to longer half-life. هذا الفيجر يوضح الهالف لايف، ماذا يحصل للدواء عندما تعطيه اي في. خلينا نقول يعني كمثال بالنسبه لهذا الفيجر. اول ما اعطينا الدواء كان التركيز ماله اعلى ما يكون، and so it is 100% after one half life. اذا افترضنا مثلا one half life مالته is 1 hour، خلينا نقول هالشكل، راح ينزل ال 50، التركيز ماله ينزل 50% like concentration in plasma. After the second half life اللي هو يعني 2 hours راح ينزل للنص ال 50 يعني 25%. third half-life نص ال 25 12.5%. fourth half-life 6.25%. after fifth half-life it will get to 3.125%. يعني تقريبا 90% of the drug concentration is declined after 3.3 half-life. Thank you for your listening. If you have any questions, you can ask me on the stream of the classroom. Enjoy your day.